Until this crisis is over, every weeknight we are trying to separate the facts from the fiction surrounding the new coronavirus. And tonight we are joined by SA 2020 CEO and President Molly Cox. Molly, thank you for joining us. And, I think a lot of people see SA 2020 as, maybe not as involved in the now as you guys clearly are. What do you say to that?
I think the challenge consistently with being an organization that's thinking about the future always is that we also have to know what's happening right now, right? We are for sure results driven. We are looking at the future to see where we're going, but we're looking at data now to figure out if we're moving closer to or further away from the future our community said it wanted.
So what is your data showing you right now when it comes to unemployment? Obviously, the hospitality, the tourism, the bars, they are hit the hardest. If we're talking about just areas of town where you're seeing the most unemployment claims, what does that tell us?
Yeah, we had been looking for more specific data because we had just seen sort of numbers, and Workforce Solutions Alamo has been a great partner in sending us some information, as has Economic Development Foundation. And we found that the vast majority of unemployment claims are coming from like the northwest side of town. Outside 410 typically, and also just more to the north and definitely towards the west of our city. What's interesting about those numbers for us is when we overlaid digital access to kind of look at both, what we were finding is that the areas that didn't have as much access to the internet, and I'm not just talking like, hey, they don't have the best fiber, that they don't even have the fundamental infrastructure for broadband service or even a computer potentially in their home, those are where the claims are the least. So that's going to be sort of our southeast and west sides of our city, which, to be fair, is twofold and multifaceted and complex. One, it means 75% right now of all unemployment claims are coming in from the internet. That's a Texas Workforce Commission number. So we know that the vast majority of unemployment claims are coming in online. So if you don't have access to online, how are you, if you're sitting on the phone, how are you getting your unemployment claim in? And then secondarily to that, we also know that per capita income and unemployment numbers were actually higher in our northern cities, part like the north and the northwest, and on our south sides, west and east, where the vast majority of our Hispanic, Latina populations, as well as our Black, African American San Antonians live, we were seeing higher underemployment numbers. So that means somebody who's working full time but still living in poverty.
Right. And, you talked about you don't have access, because a lot of these offices are closed down. Like you can't physically go in and file an unemployment claim right now.
Well, right. And let's be clear, we're seeing hundreds of thousands of unemployment claims right now. Predominantly female is what we're seeing coming through, predominantly Hispanic coming through. But the major conversation to also have is the system, right, was not built for this many unemployment claims. Nobody ever assumed that it would happen. So COVID-19 has really not created brand new need. It's just compounded the need that already existed. So what we're seeing is our system is being taxed even higher, right, than it's used to doing. So calling or trying to get online when the system doesn't have enough people to take in calls or to take in the amount of unemployment claims is also proving to be difficult.
Is there something that you're seeing that surprised you? Is there one thing that you saw that surprised you in the numbers or in the impact or what you're looking at?
I will tell you it's not surprising, but it's always interesting to see, right, when you can verify an assumption. We have been tracking healthcare access, so in insurance coverage. We knew that health insurance coverage was, again, lower in our southern regions of our community, particularly if you use Highway 90 as sort of a break in our community. More specifically, we knew, based on the impact report we released this year, that there's a population of people between the ages of about 18 to 50, so that working age population where health insurance coverage dips a lot We also know, again, if we're thinking about disaggregating data and really trying to figure out, target our interventions, our Latino populations, our African American populations have lower health insurance coverage. Why that's important, or what was surprising, is that when we started to see COVID-19 come out, and people were starting, the city started to release their data on where the known cases were. The first, if you remember, it was a couple months ago, we started to see some higher numbers in areas like 78209
Right.
or the center city, right? And everybody was like, oh, what does that feel like? And we were like, that's interesting to us. Why is that? So we mapped medical facilities, which you can see on our dashboard. So we mapped every medical facility in San Antonio, Texas. And what we found, again, if you use that Highway 90 as sort of a dividing line, many medical facilities are in our central to northern districts, and many are not below that Highway 90. So then when the city announced it was doing mobile clinics, right, to bring, hey, you may not have a medical facility near you, or you may not have health insurance, so we'll bring a mobile clinic so you could do testing. And now we're doing asymptomatic testing. We were hoping, or trying to see where those would be mapped.
Yeah.
So I think that'll be interesting to watch. Where do those mobile facilities end up?
Yeah, we talked to Dr. Lisa Ochoa, who has many clinics on the south side, and she basically said, I don't think these people are getting tested. That's why we're seeing the 78209s and some of these others at the beginning.
That's exactly right. Because if you don't have health insurance, you're not going to the doctor.
Are you seeing, when you talk about the digital divide and income inequality and healthcare inequality, all of these same areas showing up?
Yeah, same areas, same populations, right?
Yeah.
We're seeing it's compounded and it's all interrelated. And I think that's part of the job at SA 2020, is to help people see that it's not as easy as a quick fix, right? It's complex, and it's long-term, and it's pervasive, and it's systemic, and it feels overwhelming. And yet, I cannot stress enough, Steve, we've been doing this for a near decade, and we can show you, when we focus, when we do targeted interventions, we see progress.
Teen
pregnancy
birth
rate, right? And like, teen pregnancy rate is down. High school graduation rate is up. We are seeing more students when they are going to enroll in higher ed, going to four-year universities rather than 2 years, which is a very interesting shift for our community. We have seen healthcare enrollment has actually gone up significantly. Voter turnout, we can talk about all day long. It's abysmal still. It's hitting at about 13% in municipal elections, and yet that's up from 6% a near decade ago.
Right.
There have been real positive changes, and what this tells us is the information helps us make better decisions to then create the results we want to see in our future.
All right, I want to quickly, before we let you go, because we're running out of time here.
Sure.
SA2020.org is is the website, and then you have a new website I want to talk about. weisgreater.org, correct?
That's right. Yeah, weisgreater.org is something that is sort of a passion project for us at SA 2020. We have been paying attention over the last decade of organizations and individuals who have really sort of figured out how to focus their programs and services. And when COVID-19 happened, we launched weisgreater.org just to show how quickly our institutions and individuals would pivot to meet community need, right? We saw CPS Energy said, we won't shut off your electric bill. Saha started making sure that they were not evicting anybody. We saw SAISD immediately put Chromebooks in the hands of all of their students. There were the city did $25 million towards housing help when it came to internet and utilities and rent, and right. So there have been so many amazing institutions who quickly shifted, and that's big ones. There were also tiny ones who did some amazing work as well, right? There's like coffee shops who've been delivering food to senior citizens.
Yep.
And it's been amazing. We wanted to start tracking that. One, because we wanted to show people in San Antonio, Texas, when we wrote our community vision and we said we are all responsible for our collective well-being, we meant it. And then secondly, we wanted to show, hey, these are policies and programs and resource allocations that we could continue beyond COVID-19 if we truly have the courage to understand targeted interventions build up an entire community.
I love that. We is greater than me.
Yep. We is greater than me always. Go to weisgreater.org.
All right. Molly Cox with SA 2020. Appreciate your time tonight, Molly.
Thank you, Steve.
All right. Take care. We'll be right back.